Hi, this is Dr. Alvin Philipose over at Ventura's Clinic, and today I'm going to be talking about lumbar spinal stenosis and how prolotherapy can help. Lumbar spinal stenosis. Do you have pain in your back? Do you feel like your leg is tingling? Well, spinal stenosis, which is what they call a spinal canal narrowing, can cause some pretty serious symptoms, including pain, tingling, and numbness. But don't worry, I'm here to help. So what is spinal stenosis? Spinal stenosis is a narrowing of the space within your spine, which can put pressure on the nerves that travel to the spine. So your spinal canal, basically the hole in between your vertebra, houses your spinal cord and all the nerves that go out of the side. So in your neck, it can actually go down into your arms and fingers. So if you wake up with numbness, tingling in your fingers, or even nerve pain. And in the back, it can go into your buttock area, down the legs, and even into the bottom of the feet, numbness, tingling, nerve pain. And most commonly, it's because of wear and tear in the changes of the spine, especially what they call degenerative disc or osteoarthritis. It's the same type of arthritis people get in their knees, except it closes the spinal cord or the nerves around the spine. A lot of doctors may recommend surgery to create that additional space for the spinal cord to breathe, basically. And here in this next slide, you'll be able to see what it looks like. So the pinching of the back of the spinal cord. And you can also have stenosis where the nerves itself come out of the side. You can actually have the little hole and it'll actually collapse on top of that nerve, which can cause similar pain. So sometimes the whole sciatic nerve doesn't have to be affected, just one of the nerve roots that come out. And same thing in the neck. It can go into your shoulder blades, in between your spine. It can affect ribs and your breathing. It can even affect sometimes in the front of your chest. All that can be related. Other things to look for are herniated discs and bone spurs. The backbone that runs from the neck to your low back, that is what forms a spinal canal. And some people are born with a small spinal canal or a stenosis. Some people get it from a herniated disc, and some people get it from degenerative disc or the arthritis. A lot of our cases that we see, it's actually a combination of a couple of those things. It causes the weakness in your legs. It can actually affect various organs. For example, the two types of stenosis, like I said, is one in the neck, one in the back, but we have seen them in other areas as well. A lot of the evidence is seen either on an MRI or CT scans, but a lot of people have stenosis, they just don't have any type of symptoms. And by the time they do have symptoms, it's either a gradual onset and it worsens over time. But a lot of times what I've seen is, let's say you're picking up a piece of paper or something happens where you sneeze and something simple happens where all of a sudden you've got this radiating pain going down. Well, that's because the stenosis itself has become unstable and all of a sudden you have these symptoms. And it can also reflect as a weak grip, muscle weakness in your arms or legs, trouble walking. You can have atrophy of the muscle or wasting away of the muscle and some other stuff, including loss of bladder control. Like I said, some people don't have stenosis, but complications, if you leave it, it can actually cause permanent numbness, weakness, balance problems, incontinence, and sometimes even paralysis. Especially the older you get with things like osteoporosis, osteopenia, scoliosis, and other disorders, stenosis itself can actually progressively get to a point where it can be debilitating, and the surgery for something like this is actually pretty intense. So how can prolotherapy help? Well, prolotherapy is an alternative treatment option that I use where it's a combination of using a various natural solutions. Sometimes you can get away with a dextrose or sugar solution with some minerals and vitamins, or you can get comprehensive with more advanced stuff such as collagen and minerals, and we create an alkaline type of solution, and it's injected into ligaments and joints around the damaged area. And what it allows is, it's almost like creating a type of glue that holds everything together and creates some sort of healing for stability of the spine so that you're able to do your normal activity. Along with that, I use things like spinal decompression, dry needling, rehabs, stretching, strengthening, massage. There's a lot of other treatment options that you can do to get a more comprehensive approach. If you have any other questions, you can schedule a consult with me, and I always offer a free MRI review, but I am a big fan of digital motion x-ray, ultrasounds, MRIs. We get a really good picture of what's going on to see if maybe prolotherapy may be your answer for lumbar spinal stenosis or cervical spinal stenosis.